Kwekwe, Tanse, Unusakut, bonjour and hello. I want to acknowledge first that I'm on the traditional territory of the Algonquin and Anishinaabe people. Aujourd'hui, je suis accompagné de mon collègue, l'honorable Harjit Sajjan, ministre de la Défense nationale, du chef d'état-major de la Défense par intérim, le lieutenant général Wayne Eyre de façon virtuelle, ainsi que je vois sur l'écran aussi la sous-ministre de la Défense.
As well as the Deputy Minister of Defence.
Et évidemment, la sous-ministre des Services aux
And
Autochtones,
here in
Chris
the
Fox,
room,
et du Dr.
my
Tom
Deputy
Wong,
Minister of Indigenous Services, Christian Fox, and Dr. Tom Wong, who is the head of public health for
les Forces armées canadiennes
Indigenous
ont
Services
appuyé la
Canada.
campagne de
In the
vaccination
last few
partout au pays.
weeks, the Canadian Armed
Et grâce
Forces
à
have
leur soutien,
supported
plus de
vaccination
50%
campaigns
de la
across
population
the country.
adulte autochtone est
Thanks to their
maintenant
work,
vaccinée au
more than
Canada,
50% of the
territoire
adult
et des
Indigenous
populations
population
sous réserve.
in Canada
Nous observons de
has
très
been
bons
vaccinated,
progrès
that is,
réalisés
on
avec les
reserves and
partenaires
on
autochtones,
Indigenous
provinciaux et
territory.
territoriaux.
We've made
Dans
very good
l'ensemble,
progress
en
thanks
date
to
du
work with
23
Indigenous
mars, donc
people
hier,
and their
226
representatives.
790 doses avaient été administrées dans plus de
In all,
610
more
collectivités
than 226,790 doses have been
Dans les territoires du
distributed
Nord-Ouest, la
to
moitié de la
Indigenous
population
people. In the
adulte a
Northwest
maintenant reçu
Territories,
au moins une
more
dose du
than
vaccin.
half of the
Ils font de grands
Indigenous
progrès et
population
prévoient
has
terminer
received
leur
at least
déploiement
one
des vaccins à la
vaccine.
fin du mois
We're
d'avril.
making great progress, and vaccination should be done by the
On
end
a
of
récemment annoncé
April.
que plus de 78% de la population
In Nunavut,
adulte avait reçu
more
les
than
2 doses du vaccin contre la
70%
COVID-19.
of the population has received, the adult
Le Nunavut
population
a
has
maintenant
received
reçu
more than
suffisamment
2
de doses
doses.
pour vacciner
Nunavut now has
75% des adultes
enough
du territoire. Je suis
doses to
également très
vaccinate
heureux d'annoncer aujourd'hui
75%
que le
of the
Nunavut se joint au
population.
Yukon pour
And
n'avoir
Nunavut
aucun
is
cas
joining
actif
Yukon
de
currently
COVID-19 présentement.
in being able to say they
Cela
have no
témoigne des
active
efforts des
cases of
gens
COVID-19.
d'Arviat et de
This
partout au
demonstrates
Nunavut
the
qui travaillent fort
efforts
pour
that have been
assurer
made in
la sécurité
Arviat
de
and
leur
elsewhere
collectivité.
to
Je suis
ensure that their
optimiste quant au
communities
progrès
are
que nous
safe.
faisons
I'm
ensemble pour inoculer
optimistic
les
with regard
personnes
to
qui
the
en ont le plus
results
besoin.
that we're
Néanmoins, les cas actifs continuent de nous
reaching.
préoccuper.
We're meeting the
À ce
people
jour,
who
dans les
needs of
communautés
the
des
people who
Premières
most
Nations
need it.
situées dans les réserves, nous avons connaissance de
On reserves,
1083 cas actifs,
there are
ce qui nous amène à un
currently
total de
1,083 active
24
cases for 24,161 confirmed
pour les première et
cases
deuxième vagues.
during the
Nunavik,
first
nous
and second
recensons un total de
wave.
6 cas actifs. Nous devons rester vigilants. Nous ne
We
sommes
must
pas à l'abri
remain
d'une troisième vague
vigilant.
qui pourrait
There
avoir des
could be a
conséquences
third wave,
catastrophiques et
and the
dévastatrices,
results
surtout pour
could
les
be
communautés autochtones.
catastrophic, especially for
As
Indigenous
such,
communities.
our government announced last week additional support from the Canadian Armed Forces to support Indigenous communities in Manitoba for the distribution of COVID-19 vaccines under Operation Vector. With First Nations, we're working to support this goal and to identify specific communities where support is needed. Planning is currently underway for Norway House, God's Lake Narrows, Barons River, Little Grand Rapids, Opiponampiwin, Northlands, Mantosipi, and Sesidene. The Canadian Armed Forces will be supporting the vaccination programs in up to 23 communities in close collaboration with First Nations community leadership until at least June 30th. Military members will support in many ways, from helping to coordinate the delivery of supplies to administering vaccines to patients and transporting community members to and from clinics where required. As an example, CAF will deploy aircrafts and logistical vehicles and hundreds of CAF members. This will enable to meet the tailored needs of the supported communities. This operation will accelerate the pace of immunization in the province. Manitoba First Nations leaders are making plans to vaccinate all adults in all 63 First Nations communities with a goal of reaching 100,000 people in 100 days. Together, we will make sure that residents' needs are met and that everyone can be safe and healthy, and we will continue to be there if need arises. But I want to make this clear. This campaign could not be possible without the determination and hard work of First Nations leaders in Manitoba, including the amazing work of health leadership, in particular, Indigenous-led pandemic teams, and in particular, the work of Dr. Marcia Anderson. I served as an infantry soldier myself. I'm proud and grateful for the CAF members who are working shoulder to shoulder with us. The COVID-19 pandemic has shown us how important it is to stand united and support one another in Canada. Over the past year, the Canadian Armed Forces have deployed across the country and stepped up to help in more than 50 Indigenous and Northern communities. They supported 46 communities across Canada in their response to COVID in many ways. In some cases, they transported and distributed supplies In other instances, they helped set up emergency shelters, informed residents on how to reduce their risk of infection and protect themselves and others of the communities, and hunted and fished and cut firewood so that people had what they needed. In Manitoba, specifically, the Calf of Binnen, Matthias Colomb Cree Nation, Shamattawa First Nation, Pangasi First Nation, Red Sucker Lake, Opaskwayak Cree Nation, Garden Hill First Nation, and Cross Lake Cree Nation. These initial efforts have all resulted in managing the outbreaks of COVID-19 and have set the ground for vaccination efforts. This is the armed forces at their best. I'm optimistic at the progress we're making. We're making it together to get people the vaccine who need it most. Still, our focus is clear. This is a race to administer the last vaccine. Before I turn over now to Minister Sajjan to provide more details on the CAF operation in Manitoba, I want to acknowledge that today is World Tuberculosis Day. In Canada, TB disproportionately affects Inuit families and communities. In fact, the incidence rate of tuberculosis among Inuit living in Inuit Nunangat is more than 300 times the rate for the Canadian-born non-Indigenous populations. And for First Nations, that rate is 40 times. It's unacceptable. And that's why our partners, in particular Inuit Taprit Kanatami, we made a commitment to reduce the active TB rate by 50% by 2025 and to eliminate TB across Inuit Nunangat by 2030. And although efforts from public experts have been focused on COVID-19 for the past year, our commitment remains. We saw that when we worked together in partnership. We were successful in protecting peoples and communities from COVID-19. Convinced that we can do the same when it comes to TB and eliminate this disease for good. Je vais maintenant passer la parole au ministre Sajjan.
Merci. Give the floor to Minister Harjit Sajjan. Thank you.
Thank you, Minister Miller. I would like to acknowledge that I'm joining you from the unceded territory of the Coast Salish peoples, including the Musqueam, Squamish, and Tsleil-Waututh First Nations. But before I begin, I would like to address media reports about an investigation that was conducted by the Royal Canadian Navy. We need to make sure that those who come forward feel safe and confident when sexual misconduct and harassment are reported and investigated. I learned of the conclusion of this investigation late yesterday, and I have concerns. That is why I have spoken with Lieutenant General Eyre and have asked him to look into this and conduct a review on how this matter was handled. We need to look at what additional steps can be taken to ensure that every Canadian Armed Forces member feels safe to come forward. We will, and that we must do better, and we will. Now, COVID-19 has taken a significant toll on people across our country. It has hurt people's health, their mental well-being, and their financial stability. Those effects have been felt particularly hard in the Northern and Indigenous communities. We will always uphold our responsibility to support each other and keep everyone safe. That's why over the past year, as part of both Operation Laser and Operation Vector, the Canadian Armed Forces deployed across the country, supporting the fight against COVID-19. Whether providing care in long-term care facilities, transporting vital supplies to remote areas, or assisting in more than 50 Indigenous and Northern communities, the Canadian Armed Forces have stepped up to help. In many cases, that help has come from Canadian Rangers who are members of communities themselves. In fact, Rangers serve in more than 200 Canadian communities from coast to coast to coast. And last spring and summer, they were active across the country, from Haudenosaunee in British Columbia to communities across all three territories to Nunavik in Quebec. They checked on people's well-being. They helped transport and distribute supplies. They hunted and fished and cut firewood so people had what they needed. They supported local authorities in their emergency centers. Canadian Rangers helped many communities to stabilize and let them know that we were there for them. This work continued into the fall and winter as Canadian Armed Forces assistance was requested by communities. In November, a military medical team helped manage an outbreak at the Rod McGillivray Memorial Care Home in Nepal, Manitoba. And in December, they were activated in Shamattawa First Nations to help local officials. They informed residents on how to reduce their risk of infection and protect themselves and others in the community. And later that month, more Canadian Armed Forces members arrived to set up an alternative isolation area and provide medical assistance. And starting this January, They have been supporting the delivery of the COVID-19 vaccine in more than 20 communities of the Anishinaabe nations in Northern Ontario. And these examples continue. When there is a need, the Canadian Armed Forces answers the call. It's what they do best. They have the unique skills to be able to support remote communities, and I'm proud of their effort. I would like to announce today that the Canadian Armed Forces will be responding to the most recent request for assistance from Indigenous Services Canada to support the Indigenous communities in Manitoba. This support has been requested for March 22nd through to June 30th. Manitoba is home to 63 on-reserve First Nations communities. 23 of these are located in remote and isolated areas. In true partnership fashion, the Canadian Armed Forces will support Indigenous Services Canada in vaccination programs led by Indigenous community leadership. From March 19th until the 22nd, a planning team deployed to Thompson, Manitoba to set the conditions for CAF support. This included a detailed reconnaissance of the airfield of Thompson Municipal Airport. Canadian Forces members will start arriving in Thompson tomorrow to set up a staging hub and will be ready to begin operations on March 29th. Our members will help coordinate and deliver supplies to our partners. Our medical personnel will provide assistance and administer vaccines to patients. And our logistics professionals will help establish on-reserve vaccination clinics, as well as transport community members to and from clinics where required. This is truly a team endeavor led by Indigenous community leaders and supported by the Assembly of Manitoba Chiefs, Indigenous Services Canada, the Province of Manitoba, the Canadian Armed Forces, and other partners. Together, we will make sure the residents' needs are met and that local leaders are well supported in their effort against COVID-19. And I'm so proud of the Canadian Armed Forces members who are working shoulder to shoulder with our partners. The COVID-19 pandemic has shown us how important it is to stand united and support one another. We will continue to help Indigenous communities and support our government partners as we pull together during this pandemic. Thank you.
We will now take questions from journalists. One question, one follow-up. We'll start with questions from the phone. Operator, over to you.
Thank you. Merci. Please press star 1 at this time if you have a question. S'il vous plaît, appuyez sur étoile 1 maintenant pour poser une question. You may cancel your question at any time by pressing star 2. Vous pouvez à tout moment annuler votre question en appuyant sur les touches étoile 2. The first question is from, la première question est de Boris Proulx de Le Devoir. Please
Boris
go ahead.
Proulx from Le Devoir, please go ahead.
Bonjour, j'aurais une
First
question
question.
pour M.
I have a
Miller,
question for
probablement,
Minister
c'est
Miller,
au sujet
I
de
guess,
l'approvisionnement en
with
vaccins.
regard to
Le New York
vaccine
Times
supply.
rapporte que
The New
l'Union
York
européenne
Times has
doit
said
adopter une loi pour restreindre l'exportation des vaccins.
that
Reuters nous dit que l'Inde va aussi
Europe will be
suspendre ses
adopting a law
exportations
to
probablement d'AstraZeneca. Donc, je voulais savoir si
unfortunately, the
le
sound is not
gouvernement
good enough
fédéral
for the
avait
interpreter.
des garanties
Interpretation will be
particulières que le Canada
interrupted
sera
until
pas
the sound
touché, que le
improves.
Canada va recevoir ses doses comme prévu.
Boris, la dernière nouvelle que
Answer.
j'ai, c'est
Boris, the latest news that I
que
have
nous avons ces assurances.
is that we have been
Nous
assured
continuons le dialogue, évidemment, avec
that
nos
we'll
partenaires
receive
européens.
our supplies,
C'est
but
la
we
raison pour
continue
laquelle on
to
a un portfolio de
remain
plusieurs
in
vaccins
touch
et
with our European
des
partners.
pistes
That's why
d'accès
our
de
vaccine
plusieurs sources. C'est la
portfolio
raison pour laquelle on l'a
involves
fait au tout début.
different
Donc,
sources,
c'est à suivre.
and that's what
Mais
we've been doing
l'assurance que
since
j'ai,
the
c'est
very
que nous ne
beginning.
serons pas
But
affectés.
I've been assured that our vaccine supply will not be
Merci. En
affected.
question suivie, on va
Follow-up
plus
question.
être dans votre dossier des affaires autochtones. On a publié
With
ce matin
regard to
un
Indigenous
article selon
services,
lequel
this morning
l'Assemblée
we
des Premières
published
Nations du Québec et du
an
Labrador
article saying that the
trouve qu'il manque de
Assembly
mordant
First
dans le
Nations of
projet de loi
Quebec and
fédéral
Labrador
C-15 puisqu'il y
feels
aurait
that
de
Bill
l'obstruction du côté du
C-15
gouvernement
is
du
not
Québec ou en tout
strong
cas
enough.
qu'on ne sent pas de
There has
volonté
been
d'inclure la déclaration des
filibustering,
droits des Autochtones des Nations Unies dans la
or
loi
rather,
du côté
Quebec
du
has
gouvernement
been
du Québec.
putting spokes in
J'aimerais
the
savoir
wheels
si vous
of your
constatez
project.
aussi des
There's not
réticences
the willpower to move forward with
de
this
la
bill.
province du Québec. Est-ce que c'est
What
particulier au
do you
Québec
think
ou
of
si vous avez un
Quebec's
commentaire à faire
reserves with regard to this bill? Do you have any comments for us?
Ben, Boris, je vais
Answer.
répondre en ordre
Boris.
inverse. La réticence de la part de plusieurs provinces, incluant le
Several
Québec, existe
provinces
pour des motifs
have some
variés.
concerns about this bill for various reasons.
Dans la réconciliation au niveau législatif, avec les résultats concrets qui suivent, c'est évidemment
Of course, the desire for reconciliation has been spearheaded by the province of British Columbia. The efforts, rather, for reconciliation. BC has done a great work in this regard, and I invite you to take a look for yourselves. We have our own challenges here at the government, but we want to absolutely to have this bill adopted, that it receive royal sanction.
Ceci étant dit, j'ai toujours et je persiste à avoir beaucoup d'espoir en ce qui a trait à avoir des résultats concrets pour les peuples autochtones.
That we will be able to have good results for Indigenous peoples, whether it comes to health jurisdiction
les dernières déclarations
and the latest declarations by the minister, Lafrenière in Quebec, lead me to believe that there is a ray of hope on the horizon. However, this is a constant dialogue that we have with provinces with regard to upholding Indigenous rights, whether they are ancestral rights or other claims that have been made that have already been enshrined, rates that have been enshrined that have not been met or upheld. This is a challenge for Canada, but I can tell you that today, well, there are many details that I don't need to go into right now, but the way forward is simple, working together, working with Quebec, either with regard to C-92 or Bill C-91 with regard to Indigenous languages. The answer is conversations and dialogue. No matter what Quebec's official position is, I have the impression that there is the willpower to make a difference. And that's why there is this pressure this week with the Assembly of First Nations of Quebec and Labrador.
Next question on the phone.
Thank you. Merci. The next question is from La prochaine question est de Zach Vichera de Saskatoon Star Phoenix. Please go ahead. À vous la parole.
Thank you very much, and thank you, Minister, for taking my question. Minister Miller, a few weeks ago, I asked you about a proposed plan to buy COVID-19 through private channels from First Nation in Saskatchewan. James Smith Cree Nation Chief Wally Burns has told me that he wasn't dissuaded by your comments a couple weeks ago that such deals could pose the question of fraud or even be dangerous to the vaccine supply. I'm wondering what correspondence you've had with him or the FSIN on this matter, and what your options are when the leader of a sovereign nation doesn't seem to be taking your advice on something that's important.
Hi, Zach. Well, first, the dialogue has to be respectful, and part of having a respectful dialogue with First Nations is we do our best not to discuss it publicly. You know, there does come a time when we do have to speak publicly about it, but we're very careful in our choice of words because we want to maintain that respectful relationship. I disagree with Chief Burns. He knows it. Our team knows it. It doesn't mean it jeopardizes any other conversations we have. We've said time and time again, we don't believe this to be a legitimate source. And my fear, while I do worry about use of funds or fraud, my greatest fear is the safety of Canadians and end users. We all know, and you have here today, 4, 5, 6 of the people in government who spend a good chunk of their days ensuring the chain of custody of those vials that are, for any person around the world, liquid gold. And so there is a whole process behind that. We need to respect it. Ensuring the safety of that chain of custody is key. And the only assurance I have at this time is that the government of Canada can secure that. We don't try to put a stick in the wheel for anyone trying to procure their own sources, but we highly discourage it for those reasons. And I will leave it at that. It doesn't change any other position I may have with any other community that has pushed quite hard for this. I need to respect their views, but I do respectfully disagree with their view in this case.
Thank you. And as a follow-up, if I could, Saskatoon Tribal Council Chief Marc made some comments last week in regards to a PPE procurement deal that was brokered by James Smith Cree Nation along with the FSIN. My understanding is that the FSIN approved that $5.5 million of funding be flowed from ISC through them, James Smith, to purchase PPE. Chief Arcan said that some of his communities still have not really seen a plan for how that PPE is being delivered, have some concerns about whether it's being distributed fairly and equally. I wonder if you're aware of those concerns and if there's anything ISC is doing on that matter.
Yeah, well, I can confirm, Zach, that we did provide the funds for FSIN to procure PPE. It made sense. And as to any disagreement there may be as to its distribution, that is really up to the chiefs themselves, and it would be highly inappropriate for me to insert myself into that conversation.
Great. We'll take one more question from the phone and then turn to the room.
Thank you. Merci. The next question is from, la prochaine question est de Geneviève Normand de Radio-Canada.
Geneviève Normand de Radio-Canada, you have the floor. Please go ahead.
Oui, bonjour.
Question. My question
Miller.
is for Minister Miller.
Il y a des femmes autochtones,
Indigenous
Miller,
women,
qui,
some Indigenous women
de la part
are saying that it's
gouvernement
hypocritical of the part of the
Chine,
federal government to denounce what's happening in China with the Uyghur women who are being sterilized. They think it's hypocritical for Canada to condemn China when sterilization of Indigenous women was forced upon them. What do you think of that?
Ce serait, Geneviève, loin de moi d'avoir une opinion sur cette prise
Geneviève,
de position. Je me dois de respecter leur point de vue.
I must respect their viewpoint. We know that there have been atrocities carried out and well documented against Indigenous women. We know that there's work to be done, tremendous work. We have the burden and the privilege of interacting with Indigenous people respectfully. And what distinguishes us from China, there are many things, is that Canada has recognized what was done, and we're trying to make amends. We're talking about centuries of colonization that predate even the Confederation. We won't be able to solve things overnight, of course. If one thinks so, then the scope of the problem is not really understood. If we compare ourselves to China, then we have the impression that China is hiding a lot of things from us.
Oui, merci pour votre réponse. Je comprends bien que le
Follow-up
Canada ne s'en
question.
cache pas,
Thank you for your answer. I can understand that Canada does not want to comment, but it's 2021. We know that there has been sterilization, forced sterilization of Indigenous women. What are you doing about it? Answer. It's, of course, my responsibility and Minister Bennett's responsibility, as well as the responsibility of the premiers of provinces. We're talking about health. Of course, it was completely unacceptable that Indigenous women were sterilized without their consent. We are making efforts to ensure that Indigenous women who require hospital services are accompanied during decision-making, and that they have more support, more access to support. But there's still a tremendous amount of work to be done. It's obviously an unacceptable situation that cannot continue. It is the federal government and the provincial government's responsibility.
We will now take questions from the room.
Mercedes Stevenson, Global News. If I could put my first question to General Eyre. General Eyre, the Defence Minister has asked you to look into the unit discipline review carried out by the Royal Canadian Navy. That review, Global News has learned, was conducted and concluded without speaking to all the witnesses or even all of the complainants. It only looked into a limited number of the comments, and the advice given to junior people in the Navy was that they should confront senior officers if they felt uncomfortable, including in a public environment. Chain of command has been a tremendous issue when we've been talking about military sexual misconduct. I'm wondering if you can walk us through what your review of this investigation is going to look like.
Well, Mercedes, thank you for the question. Half an hour before this session, I issued some direction for a review of that investigation. What I know at this point is 132 members that were on that session were reached out to, and 54 responded. But I have some more follow-on questions that need to be answered before I can give you a fulsome response. But I will add that I expect leaders at every level, when they see something that doesn't look right, something that doesn't sound right, to take action immediately. And so that is the expectation that I'm communicating to all members, all leaders of the Canadian Armed Forces.
Minister Sajjan, if I could follow up with you. You've said in the past you didn't feel comfortable directing investigations. You have directed the CDS to look into this. Why did you feel comfortable in this situation taking that direction? And do you believe it's time to have reporting for sexual misconduct outside of the Canadian Forces reporting to Parliament and not to the Minister's office?
No, Mercedes, thank you very much for the question. As you know, we take all allegations extremely seriously, and the report that was that came out yesterday was very concerning. I asked General Eyre to conduct a review so that we can determine how things were handled in this matter. And these are some of the things that are what we do on a regular basis. But conducting a review to find out what went wrong, how can we improve, is something that we need to do. Because it's only through this we're going to determine how we're going to be able to change the type of culture to move forward.
Good afternoon, Olivia Stefanovich, CBC News. Minister Miller, I would like to ask you about proposed reforms from your government to the Official Languages Act, which would essentially solidify the bilingualism requirement for Supreme Court of Canada appointees, the justices there that sit on the bench. Some people think that this would hurt diverse candidates, especially Indigenous candidates. What do you think of that? And do you think that there should be some exception made for Indigenous candidates who speak an Indigenous language but don't speak French?
Yeah, just on that, the last point made me hesitate, because I think that it underscores, I think, a bit of the challenge we're facing in Canada is to recognize that while we are an officially bilingual country, we have a number of dozens and dozens, 63 Indigenous languages, and if you look at the census, perhaps more, that have been destroyed through residential schools, and I meet on a daily basis people fighting to bring them back, and there's different levels of vitality, whether you're talking about ranging from Cayuga to Inuktitut, in the range of vulnerability, but they're all under threat, and that is the situation we face as a country. The reason I reacted early to the end of your question is because you're presuming everyone can speak English, and that is not necessarily the case. There could be also situations where you have someone that speaks French and their own mother tongue, Indigenous mother tongue, and no one talks about that. Why? Because the discussion that we're having is about the fragility of the French language. And so the efforts on ensuring that the highest court in the land people are able to speak in both official languages is one that is key to who we are as a country. Would it unduly? There's a number of incredible candidates on the bench that are Indigenous, and I believe, and we're talking. Let's be honest. We're talking about whether they could learn French, because if they have not learned English, they're probably already prejudiced by a system that underappreciates the value of French in some cases. And so we're juggling a lot of considerations. It has been challenged constitutionally, or been questioned constitutionally, whether to ensure legally that bilingualism would be a requirement. So that is something that we're going to look into. And I think if you look at the document that Minister Joly is heading up, it is something that we're going to look into. The Prime Minister, as a matter of policy, is ensure that people are functional in both bilingual languages. And I think, frankly, as a practical matter, I think we can get there where we have an Indigenous judge that is able to express themselves in both languages. But I don't. You kind of painted it in a bit of a binary way, but there's a lot of folds in there that we're juggling, and I think it is important. I don't think a candidate should feel prejudiced, but because simply by virtue of the fact that they wouldn't know one of the official languages, but we're talking usually about French, and I think it would kind of sweep under the carpet a lot of the work that has been done by a lot of people on the bench to learn French. And the incredible amount of the incredible pool of candidates coming up that are Indigenous that would make amazing contributors to the bench. And I won't comment on their quality of French vis-a-vis the ones that are already on the bench.
Okay, thank you. And just switching gears, I also would like to get your reaction to a new study that's out today by the National Indigenous Fire Safety Council Project. They say their study shows that between 5 to 17 Indigenous people are 5 to 17 times more likely to die in a fire than the general population. And they attribute this largely to the fact that there is no national fire protection code on reserves. Is your government going to move to change that?
The statistic wouldn't surprise me. And it has to do with essential services and assets. It's due to a variety of reasons. So I haven't seen the detail of the report, and I would have to actually read it myself and look into it in a little more detail to be able to comment on it. We know there's sort of a presumption sometimes that because there isn't a code that we are quote unquote applying, that there aren't standards that are being upheld, and that's not the case. I think in a lot of the cases, the discussions turn less around standards than around the critical infrastructure that needs to be provided to communities in order to keep them safe. And I think that's the discussion we get into anytime we say, we're going to impose this standard, impose that standard. Communities turn around and say, well, you can impose those standards all you want, but you haven't given us the infrastructure to do it. And that's the standards. Some of the comments we get back is we'll figure it out ourselves. It doesn't mean that there shouldn't be a national approach to it. And there's a lot of willingness, and there's a lot of groups that are pushing for that, as you mentioned. But again, it's a little more of an intricate and detailed discussion. I would want to read the report before commenting further.
Would you commit to a national fire protection code on reserves?
I will commit to whatever leadership after broad consultation would prefer us to do. But a lot of the discussions I have are focused around resources and ensuring emergency services and assets are provided. And we can just talk. You can talk as a parallel discussion, but connected to essential policing on reserve, which has never been treated as essential, whereas it is in the rest of Canada.
We'll take one more question from the room and then turn back to the phone.
Stephanie Levitz, the Canadian Press. My question is for Minister Sajjan. I wonder if you could spell out, please, Minister, what is it about what happened at the Navy that made you think to order this review, and why this time and not in the case of General Jonathan Vance?
No, thank you very much for the question again. As from the reports that were given there, if a member had felt that there was concerns on how the investigation was conducted, we need to take things very, very seriously. As we said before, every member who wants to come forward needs to be heard, regardless of retributions. And because how we handle any type of investigation is about the confidence that our members have in the Canadian Armed Forces. This is why I spoke to General Eyre, and as he has said, he is going to be looking into it. And once he has looked into how the situation was handled, we will be able to say more about this.
Just to clarify, and then I'll just ask my second question. This is a lessons learned type of review. You're not asking them to reopen this investigation. You just want to know what went wrong. Is that accurate?
Well, what we need to do is, during this review, if more is learned, then they need to take it further. I can't prejudge where it needs to go, or nor do I mind putting any limits to it. When something is going to be reviewed and how something is going to be handled, if more information is found, obviously it needs to be looked into more deeply.
Okay, and then just to follow up, and I'll start my question with Acting CDS, but also Minister Sajjan. I wondered if you could shed some light on what kind of guidance you're giving members of the armed forces preparing to deploy overseas this summer. They're looking for houses, we're in posting season, and they still don't have vaccines. And there's a fear that they'll have to rely on governments, elsewhere in the world to get these vaccines. And is that fair? So what is the guidance on that, and how is it being developed?
No, that's a very good question. In fact, actually, we are monitoring this extremely closely, working very closely with the Ministry of Health and the health professionals in terms of the priority of vaccination. Our Surgeon General, through General Eyre, is working on when the priority for our Canadian Armed Forces members needs to be. And what we don't want to do is don't want to jump ahead of the line over another priority group. And these decisions will be made by the medical expert. But one thing I can assure you, not only we're looking at our people who are being posted, we're actually looking at all our members who are going to supporting our Indigenous communities, or earlier on into long-term care facilities. And we're closely monitoring all the missions that are abroad and what the situation is there and what needs to be done. And this is being done by the medical professionals, and based on their advice, I can assure you that we will make sure that our people are looked after.
Great. We will now turn back to the phone for questions.
Thank you. Merci. The next question is from La prochaine question est de Christy Kirkup from the Globe and Mail. Please go ahead. À vous la parole.
Hi, good afternoon. My first question is for the Acting Chief of Defence Staff. Yesterday,
Christy, I think we're having an issue with your mic and we can't hear you.
Can you hear me now?
Yes, we can. Thank you.
Okay, thank you. I'll start again. My question is for the Acting Chief of Defence Staff. You told the Parliamentary Committee yesterday that Operation Honor may have culminated, and I'm wondering if you think that recent allegations of sexual misconduct in the military have poisoned Operation Honor, and what you meant by the fact that it may have culminated.
So thank you for the question. The term culminated is a very deliberate term. In military operations, it means when an operation can go no further because of resources, because the situation has changed or other factors. And I believe the situation in this case has changed. And we're at a point now where we need to harvest the goodness that came from Operation Honor, learn what perhaps has not worked as intended, and come up with a deliberate plan to follow on from it.
And I appreciate the fact that there's a discussion going on about what might replace Operation Honor, but can you give any hints as to the timeline that you have in mind? When might Operation Honor, given that it has culminated as you described, when might there be a new operation underway, given the severity of the concerns that we're talking about?
So the planning at this point is still very immature. We need to listen first to get the perspectives of various stakeholders, not the least of which are our own people, but experts from both within and outside of the organization. And so that we are not dictating a plan, so that we have a significant degree of collaboration going forward so that we can have a plan that is going to work. There are going to have to be some quick hits on this, but also you can't change culture overnight, so it's going to be a deliberate plan going forward as well. I do have to add that as we change culture, and there's certain aspects of our culture that are exclusionary and absolutely need to be changed, but there's others that we need to retain. And the reason that we're here to talk about our Canadian Armed Forces members going into Northern Indigenous communities in Manitoba is part of that culture, that selfless service, that willingness to leave your families behind, especially in the context of of the pandemic, to go forth and do goodness here at home or around the world. That part of our culture absolutely has to change, has to stay, because it is so important to who we are.
Great. Thank you, Christy. We'll now turn to the next question.
Thank you. Merci. The next question is from, la prochaine question est de Ian Graham from Thompson Citizen. Please go ahead. À vous la parole.
Hello, thanks for taking my question. Can you hear me okay? Yes?
Yes, we can. Thank you.
My question is how many personnel are being deployed first to Thompson to support vaccination efforts in northern Manitoba First Nations?
I don't think
I can.
I'll pass it over to Lieutenant.
We have approximately 200 Canadian Armed Forces personnel who are going to be deploying. Included with that will be a transport Hercules aircraft, 2 transport helicopters, Chinook helicopters, and Twin Otters as well. But mixed in that is a wide variety of experts from medical personnel, logistics support as well. And I'll let Lieutenant General Eyre provide any greater details to the operation.
So thank you, Minister. Just as the Minister said, we're going to deploy up to 200 military personnel consisting of medical personnel, command and control, and general duties. The concept is to use Thompson as the hub as we deploy out to the various spokes, the various northern communities. And so the exact numbers will be determined on the ground for the task at hand. You know, as the Minister mentioned, we'll have a number of airframes, including Hercules, up to 2 Chinooks, up to 2 Twin Otters, to support this effort as well, along with a number of logistic vehicles. But the exact details of the numbers day by day will be determined by the commander on the ground.
Okay, thank you. And just following up, when are the first, when is it first scheduled to be deploying out from Thompson to the First Nations? And is there a time frame of how long they'll be in each community, or is that dependent on how many people need to be vaccinated?
So I will say we're conducting this operation in 2 phases. The first phase is what we're calling preliminary moves, reconnaissance, and staging. That is ongoing as we speak. The second phase is the actual execution of the vaccine campaign. That is scheduled to start not before the 29th of March, so next Monday, and could go as long until as the end of June. The exact time for each of the communities will depend on exactly the factors you mentioned, the size of the communities, the throughput, and the other planning factors that are necessary.
Great. Next question.
Thank you. Merci. The next question is from, la prochaine question est de Dylan Robertson from Winnipeg Free Press. Please go ahead. À vous la parole.
Hi there. Thanks for taking our questions on this. I wanted some clarity on the number of communities. You've mentioned up to 23 communities. The Prime Minister said it was 23, so I'm just looking for clarity there. And I'm also wondering if any of those 23 are non-reserve communities, and if Ottawa has pushed to include any communities with large Métis populations in the military exercise.
I'll take the first part of the question, Dylan. It's up to 23, which means up to 23. This is a process of reconnaissance and engagement with the communities, and the assessment of 23 was based on their vulnerability and remoteness after discussions with Indigenous leadership and talks with the province. Right now, we have ones that are ready to go, and when they go, they'll go. And the other ones, as we continue our engagement to make sure that the vaccine deployment is done in a culturally respectful way. And that requires preparation. But what it does ensure at the end is that you get higher uptake and higher vaccination rates and the high rates that we've been seeing going on across the country. So to answer your question directly, stay tuned. And as with respect to the Métis, you know well, Dylan, that this has been a very heated conversation, particularly with the provincial government. We continue to push the prioritization of Indigenous peoples as set forth in the NACI guidelines. And we're looking at a situation now where we are going to have a big lift, and ensuring that that is done in Métis communities in a culturally respectful way is key. They, as everyone well knows, have some of the same socioeconomic gaps as First Nations, and that needs to be respected. But it starts with and continues with discussions that are ongoing at tables with the province. Lieutenant General, do you want to complete any of that, or Harj?
Just wanted to add to this is that it's not limited to what we, from the Canadian Armed Forces perspective, we're prepared to support more communities, but we want to make sure that we do it in a collaborative way with the Indigenous leadership led by Indigenous Services Canada, and also work with the provinces, because we know that no one entity can do this alone. And what we want to do is making sure that we support the vulnerable communities, and through if greater assessments or if there's a greater need, we are ready to support more. And the whole concept is to making sure that we have the right resources to be able to go in very quickly, to do a quick assessment, come in, do the vaccination, and do the follow-ups, and then move on to the next community. General Eyre, if you have anything to add.
The only thing I would add is, like the vast majority of the domestic operations that we do, we are very much in support of other departments. So we remain responsive to what the need is. We don't necessarily determine it ourselves.
Thank you. And my follow-up is a bit of a two-parter. For Lieutenant General Eyre, I was wondering about the existing Thompson vaccination that the province is doing at the airport site and how that interacts with your own sort of work at the airport. And for the ministers, I was also wondering about the 23, if these are only reserves at this point, or if there is any non-reserved community among this list of 23.
So I have to say I have no idea what you're talking about. And can you clarify the question, please?
Sure. Sorry. There's my understanding is there's two immunization sites that the province runs in Thompson. One is the community center. The other is the actual airport itself. And I'm just wondering if there's any sort of interlace between what you guys are up to as the military and what the province is doing with flying in people to get immunized, or if that's being put on pause.
So I don't have those details right now. I'll have to get those from my staff.
Dylan, on Thompson, the CAF is part of an integrated complementary vaccination strategy. So the site remains available, but again, it's really under the auspices of the province. In respect to the 23 communities, as the Minister of Defence said, we're willing to do much more if need be. And we have offered to do, those are 23 reserves, but we've also offered to do off reserve as well.
Next question.
Thank you. Merci. Once again, please press *1 if you have a question. De nouveau, n'hésitez pas à appuyer sur étoile 1 pour toute question. The next question is from, la prochaine question est de Dan Jones from BCMP Broadcasting. Please go ahead. À vous la parole.
Yeah, good morning, Minister Miller. I was wondering if you had time yet to read the Civilian Review and Complaints Commission of the RCMP's report into the death of Colton Boushie and the treatment of his mother by officers were found to be discriminatory. Have you read that, and what's your reaction to that report, sir?
I haven't read the entirety of the report. I've been briefed on it, and what I've heard is disturbing. I've met with the family of Colton Boushie. I've met with the mother. Previously, the words that she expressed on Monday, I think people need to listen to and hear quite clearly. She should never have been put in that position. And we need to let her words speak for themselves. I think this report reflects, in my mind, the importance of civilian review. And that's key, because what the family had been telling me turns out to be the case. I would note, and you know, that that Commissioner Lucky has accepted the findings of the report. But I think at this juncture, everyone and Canadians are impatient to see action.
And Minister, just to follow up, sir, the report kind of mentioned that maybe more culturally sensitivity training should be made available to officers. And I know the RCMP has said that by next month that all officers should have completed that training. But do you think that sufficient training is enough to rid the RCMP of its discriminatory behaviors or attitudes towards Indigenous peoples?
You know, I think that you know, you've read the report. It sounds like I think you've read the other reports that have come out with respect to the RCMP. We've acknowledged as much in the speech from the throne, as well as the work that I'm doing with Minister Blair on increasing support for policing on reserve and proceeding towards legislation for policing as an essential service in First Nations. That is coupled with broad stroke RCMP reform. That's work that we've acknowledged is important. It's ongoing under the leadership of Minister Blair and Commissioner Lucky. But it is work that everyone knows one course in sensitivity training won't correct. You need to fix the institutional aspects of it. And while the firing of one or two people may be satisfying, it doesn't address the underlying root problem. And I think that's the importance and that we need to acknowledge, as well as the work that needs to be done in fixing it. And I'll say it again, it is not an overnight solution, which, while that may sound like a frustrating answer to people, and indeed it is for those that have that lived experience as they interact with police officers, it is part of the system that that under the leadership of Minister Blair, we look forward to moving forward on.
Thank you, and that ends today's press conference.
Thank you.